Lovely, it's 1:15 already. I think I'll get started now. Hello, everyone. I'm sure more people will be joining us as we go. But just to introduce myself, I'm Catherine Drake, and I am working with Autism Anglia to bring today's live event to you. So welcome to today's live Q&A about diagnosing autism and ADHD. We have had an amazing amount of interest in this event, and we've had a lot of lovely questions, really, really great questions. We're going to do our best to get through as many of them as we can. We'll be finishing today at 2 p.m, so we will get through as much as we can with the team in that time. I'll shortly hand over to the team to introduce themselves to you, but in the meantime, let me just tell you a little bit about us as a charity. So we are Autism Anglia. We're East Anglia's leading autism charity, working to enhance the lives of autistic people. We've been supporting adults and children for over 50 years, providing personalised care and high-quality facilities that encourage autistic children and adults to live a rich and fulfilling life. We achieve this through our specialist coeducational school, residential and supported living, training, education and diagnostic services. Our vision is to create an accepting society where autistic people are understood, able to access opportunities, and most importantly of all, can fulfil their potential. So we have an assessment and diagnosis service here at Autism Anglia, and we're proud to be an expert provider of gold standard, NICE compliant diagnostic assessments. I'll explain what gold standard means in a minute, and our team will elaborate further. But we offer private assessments for several things. So autism for adults and children aged 3 and older, ADHD for adults and children aged 7 and older, speech and language, and also thinking, so cognitive assessments as well. We also offer a low-cost initial screening for both children and adults, helping you to decide if proceeding to a full assessment is right for you. And why choose us, you may be asking? Well, we offer a gold standard service, which means you can expect a quality assessment from our expert team, who you're about to meet, handled with understanding and empathy from initial assessment to the post-diagnosis follow-up. So without further ado, let's crack on with some questions. First, I'm going to introduce you to our team. They're going to say a little bit about themselves. So I'm going to pass over first to Jenny, please.
Hello everyone, thank you for joining. I've been the manager for Autism Anglia Diagnostic Service since 2019. Previously, I was the Senior Autism Advisor here at Autism Anglia. I've got personal experience of trying to negotiate getting an assessment and personal experience of autism within the family. We can offer trained educational experts here, and obviously trained and experienced diagnostic clinicians too. I've given support for education, and I also run the Adult Asperger's group, which is here in Colchester monthly. I'll now hand over to Jo.
Thank you, Jenny. I'm Jo Keys, and I'm the Community Liaison Lead for Autism Anglia. I've been with Autism Anglia for just over a year, but previously to that, I worked with them for 16 years, had a year break and then came back. So the Community Connect team, we offer support to parents and individuals within the community who aren't part of Autism Anglia's school or adult services. Now over to Sarah.
Hi everyone, my name's Dr. Sarah Pir Mohammed, and I have been with Autism Anglia working in the diagnostics team for just over a year as well. I have around 10 years experience in working with children and adults with autism and ADHD, but I really love working in diagnostics because I just really enjoy the kind of working in a strengths-based way, really helping individuals to recognise and appreciate the unique strengths, I think, that come with neurodiversity. I think a diagnosis can be a really powerful moment of self-understanding and help people to embrace those parts of themselves. Over to Vicky.
Hello, I'm Vicky. I'm a speech and language therapist. I've been working at Autism Anglia for about 2.5 years now. So I'm part of the diagnostic service where I start off doing the face-to-face part of the assessment called the ADOS, and then I support clinical psychologists to help with the second part of the assessment, which is the ADIR. I'm very fortunate that I have been part of this team. We are very caring and understanding, and also there's a lot of lived experience within our team. I'm autistic and have ADHD myself, so I find it like fascinating anyone that walks through our door, and I just really try and provide as much empathy and support as I possibly can.
Lovely. Thank you so much, Vicky. Thank you everyone for introducing yourselves. And I think without much further ado, we'll get on with the questions which were pre-submitted before the event. So the first question, Kerry from Clacton-on-Sea would like to ask what the difference is between ADD, ADHD and ASD. So I think I'll pass over to Sarah for that one, please.
Thank you, Catherine. That's a great question to start off the Q&A. If we start with autism, autism is a developmental condition that affects how people communicate and how they socialise and process sensory information. And ASD is essentially the same as autism. So ASD stands for Autism Spectrum Disorder. And the reason why it's called a spectrum is because everyone experiences traits very differently. Traits vary widely. Some people might need significant support, others might be highly independent and require less support. But some of the common traits are difficulties perhaps understanding social cues. Individuals may also experience certain sensory sensitivities, have a strong focus or passion in various interests or routines, and they might also have a preference for structure or predictability. ADHD, on the other hand, is a condition that affects more someone's focus, their impulse control, and their energy levels. ADHD can be split into different types, different presentations. ADD is now an outdated term, and it's something that's included under the whole ADHD bracket. So you have the inattentive type, which was formerly ADD, and that highlights perhaps challenges focusing, forgetfulness, becoming quite easily distracted. So the ADHD presentation, but without the hyperactivity. And then there's hyperactive impulsive type ADHD, and that might look like someone struggling with restlessness, fidgeting, trouble sitting still. And then the third type of ADHD is combined type. So it's a mix of hyperactivity and inattention type symptoms. Whilst there are some core differences between ADHD and autism, there can be some overlapping traits, but they are essentially distinct conditions with very different challenges and strengths. Hope that answers the question.
Absolutely. Thank you, Sarah. That's really helpful. So Hayley from Norwich and Doug from Tendring asked similar questions. So one would like to know what some typical signs are of autism and ADHD in children, and the same question for adults. So can I ask Vicky that question, please?
Of course. So when we're thinking of symptoms in autism, we're thinking of like a dyad of impairment that's kind of going on. So we're thinking of social interaction and communication. So if we think about someone at home when they're younger, they might use someone else's body to try and communicate. So say, for instance, that a young child wants something, they could very well push that person's body towards an item they wanted. Or if they were trying to open a door handle, they can sometimes use that person's body as an extension of their own. So they might take someone by the wrist and use their hand to open a door. So those can be, some of the more physical kind of symptoms that we see. They can also be very functional and direct in their communication. So if someone turns around and goes, oh, they were quite blunt, actually it's not that at all. It's not that they're being blunt, it's just that's the way that they communicate. So they might not deal with small talk very well. It might be very functional. They want to get to the point very quickly. You might also sometimes hear a child sitting upstairs in their room and they're providing a running commentary where they're just talking to themselves for no reason at all, other than just to kind of self-direct what it is that they're doing. They might also have some kind of stereotyped and idiosyncratic language. So That would be things like saying, oh, look, there's hot rain outside, there's hot steam outside instead of rain. So we can hear some quite unusual language that goes on. One of the things that can happen in quite early development as well is when a child begins to speak, or, you know, if they're starting to be able to engage in writing or those gross motor skills, sometimes that can actually start to regress. So they might very well stop talking for a period of 3 months or more, and that can be highlighted as well. They also struggle with kind of gestures, facial expressions, and eye contact. So if someone doesn't look at you for eye contact, it's not that they're being rude or not engaging. It could just be that actually they find it incredibly painful. And then on the other side is the restricted and repetitive behaviours. So that would be things like you might see a child stimming, as sometimes it's called, where they're moving their hands rapidly, or they've got whole body movements such as spinning. There's compulsions and rituals, or lining items up. There's so many traits for autism that I don't have time to go through all of them. And the same with kind of ADHD. So where Sarah mentioned that we've got the inattentive type and then the hyperactivity impulsivity, for a child that can look like, you know, where a parent maybe goes in and speaks to a teacher and they go, oh, they keep making lots of mistakes in their work, but actually it could be that they've started a task and then zoned out very quickly from that task, so they've rushed through it because they want to finish it. They might have difficulties organising themselves, they might have difficulties following instructions or processing instructions, and they might lose items as well. So if you think about those children or even those adults who, you know, get to their car and go, oh, I've left my bag, so they go back into the house, but then they've forgotten what it is that they actually went in there for in the first place, and then they go back to their car and go, now I've left my lunch. So, you know, they could very well go back and forth to the house a few times. And in class for children, again, we might see lots of fidgeting or just getting up out of their seat to walk around because they realise that they need a movement break, but they can't actually externally explain that. And it might be that they talk a lot or they interrupt, difficulties with turn taking in conversations. And what we have found with autism and ADHD is a lot of people, and I know myself, I can describe it as I'm constantly fighting myself. So my autism aspect really wants that structure and routine and wants to know what's coming. But then my ADHD side is like, no, I really want that impulsivity and that chaos, and, you know, that's where I forget things. So I think where it's in relation to work, everything I've just described can happen at work, but we have to remember that as adults grow, they have coping strategies that actually means that sometimes they can mask what it is that they're doing at work. So where they might be at work and their manager has asked them to start a task, they might not necessarily finish it because all of a sudden they're getting really distracted by environmental noises, or you know, they might get distracted by, I don't know, TikTok or something like that on their phone, and then they might get up and walk away and then not go back to that task, which can have obviously impact around completing tasks. And sometimes we have adults that come in and go, my manager called me in again to a meeting because I haven't completed my work on time because I just got too distracted. I could go on for much longer, but I've gone well over my minutes. I do apologise. But yeah, there's so much to cover just in that one question. So I hope that sort of answered the question.
Yeah, I think so, Vicky. I agree. There's absolutely no way you can summarize that with ease, especially as everyone is so individual. I think I'll direct this one to you as well, Vicky, because Emily from Chelmsford was wondering, do you find generations not taking ADHD and autism seriously? For example, thinking it's a fad or currently quite trendy, and how can she educate her family about it?
So again, this is something that we've had quite a lot in our service, I would say, is we've had sort of, you know, the 20-year-olds and plus come in and say, well, I'm going to kind of be self-informing today because actually my parents think that, you know, I just wouldn't concentrate at school, and that was that. But actually, it's not, I think with the older generations, obviously, autism and ADHD wasn't as acknowledged as it is now. I feel like over, the past few years, our knowledge has definitely increased around neurodivergent conditions. And the way that I would kind of say to help around education is really looking into that neuroaffirming practice. So listening to those autistic and ADHD voices about, their culture and how they manage situations. Again, I don't have loads of times to go into actually how to educate, but I would say that I think having those really open conversations now about it's not that everyone's autistic, because actually if everyone was autistic, then why do some people cope and manage more in a neuro typical world, whereas neurodivergent people, they really struggle with things that people just subconsciously are able to do. So I think it's about validating neurodivergent people and helping them to understand that no, it's not a fad. It's really important that we support everyone who had that diagnosis.
Brilliant. Thank you so much, Vicky. So next question is from Nicola from Clacton-on-Sea. She'd like to know, if a person is diagnosed with a mental health disorder, for example, something like borderline personality disorder, can the doctor refer for an autism assessment? I think I'll ask Sarah this one, please.
Thank you, Catherine. Yeah, that's a great question. Absolutely, a referral for an autism assessment is possible, even if a person has a mental health diagnosis, such as borderline personality disorder. Having a prior diagnosis of a mental health disorder, of whatever it may be, does not rule out autism. And actually, autism and mental health conditions, such as borderline personality disorder, can commonly co-occur, and symptoms can often overlap. So if we're thinking about autism, borderline personality disorder, you might get the emotional dysregulation, difficulties with relationships, identity struggles, so really overlapping symptoms, and you can start to recognise therefore why perhaps people may have had their challenges misunderstood. So, many autistic individuals, especially those who mask, might have been misdiagnosed or as having purely mental health issues. So whether autism is also present in addition to mental health difficulties that an individual might have, or if it's present, on its own, and perhaps an individual has been misdiagnosed, a diagnosis or seeking an assessment for autism can really help with obtaining a deeper understanding of a person's experiences and ensuring they receive the right support tailored to both their neurodivergence and their mental health needs, if that's something that an individual is experiencing, both sides of neurodivergence as well as mental health difficulties.
That makes sense. That's really helpful. Thank you, Sarah. So Emma from Malden would like to know, are private autism and ADHD assessments recognised by the CCGs, I think we now call them ICBs, in Essex? And is ADHD medication generally available to adults in Essex or anywhere in East Anglia via the NHS? I think this one would go to Jenny, if that's okay.
Yes, that's fine. So private assessments should be just as important for being considered. However, absolutely, the ICBs totally have the right to make sure that that provider is an experienced and valid provider, and that the assessment is very robust. So this is where we would say to people, please make sure that you do your research if you're using a private provider, and that it should be an organisation that adheres to NICE guidelines and offers gold standards, such as ourselves. And the reason why that's important is that you will then get a really well evidenced diagnostic report, and obviously an accurate outcome for your assessment. Then that could be quality assured by the ICBs or any other authority. I know of an instance when a school, for example, did ask for an educational psychologist just to read through our report and for their impression. And obviously they in our instance, because we are so well evidenced, they came back and said, yes, absolutely, we quality assure this. We have no qualms at all about what we're seeing. But that's why it's important. So, you know, we should be adhering to NHS standards and be guided by all of that to get that quality assessment. And then the second part was about ADHD medication. There is a transition going on in some areas of some GPs away from what is called shared care. So I think if you're looking for ADHD medication, it is really important to speak to your individual GP and to see if they can offer shared care. And so they will be picking up basically the administration for that medication, because it can vary depending on the area that you live in. So I think that's an important conversation. It could be that they're actually looking to allocate the administration of that via a secondary person, such as a paediatrician, and then you might end up on another waiting list while that's going on. It is also possible to look to getting private medication, but again, seeking to get that transferred to the GP after an initial period of months, 3 months or so. And it's also really important that you get medication reviews as well. So even if you are signed up to your GP, getting your medications, do make sure that they are reviewed on a regular status, no matter who you're with. So I'm afraid to say it does vary a lot, and things do tend to be changing a bit at the moment. So do have that conversation before you make any decisions if it's important to you.
Brilliant. Thank you so much, Jenny. Done that one. So Joanna from Colchester wants to know, what are the benefits of gaining an ADHD or autism diagnosis as an adult? I'll ask Vicky this one, please.
So I'm going to talk a little bit about my own experience, if that's okay, just because I'm a late diagnosis, as it were. So I was only diagnosed kind of 2 years ago now. And it really did help. I'm very fortunate that it really helped being part of the diagnostics team, because I feel that even though I've worked with autistic people for well over 12 years now, yeah, I kind of made more sense when it was highlighted to me, oh, could you be autistic? Could you've got quite a few ADHD traits. So when I finally received that diagnosis, I felt a huge sense of relief and understanding about kind of, you know, through school it was very challenging, through university it was very challenging. There were lots of people, and I was like, why does it feel like they're managing and they understand the world around them, and these real social expectations that maybe, you know, why am I not understanding them? What is it that I'm missing? And I really felt like once I received those both diagnoses, it made me kind of look back and really reflect on, you know, school and university, and just think that's why I've struggled over so many years with education, or, you know, people sometimes not understanding the way that I communicate. So I think it's a lot about self-identity, and actually, you know, being able to go, this is what I struggle with and this is what I actually need help with. So it's kind of really given me that empowerment to turn around and go, no, I really need help here. So I definitely think, like, it doesn't matter your age, if you've got a question about it, and just even that, you know, oh, I've always felt a bit different, because you know, I had that imposter syndrome where I was kind of like, do I fit here? Is this, you know, am I taking someone else's autistic or ADHD place? And actually, no is the answer. Like, you know, I have every right to be in this position as anyone else who's questioning it. So I just think, you know, if it's something that you're wondering and you just want to find out why you've always felt that way, or those differences, absolutely go and seek like that assessment, because it can really be life-changing.
Thank you, Vicky. Yeah, I've heard it described before as a diagnosis as being given the keys to the kingdom of you, and I love that phrase. I think it's great. Right, the next one, Claudia from Cambridge would like to know, how can an autism assessment be carried out when with someone who has no contact with their parents and or people who knew them in their childhood? Can I ask Sarah that one, please?
Yeah, of course. Thank you, Catherine. So an autism assessment for someone with no contact with parents or people from their childhood can be a bit more challenging if there's no access to early life information, but an assessment can still absolutely be done. So we use specific assessments, which I think Vicky mentioned earlier. So we use the ADOS, the Autism Diagnostic Observation Schedule, which involves a direct interaction with the individual, and the ADIR, which stands for Autism Diagnostic Interview, and that's a structured interview to explore developmental history. In cases where early life information or details are missing, they can still be adapted even without that childhood data. The ADIR, which is the developmental interview part of the assessment, we can still adapt that to help make a diagnosis by shifting the focus to current communication patterns, social interactions and repetitive behaviours, all of which are usually also observed in adulthood. We might also go down other routes, such as collaborating with other professionals who have been involved in the person's life, get insight from other people perhaps who know the individual well, even if they didn't know the individual as a child, such as employers, close friends, just to get more of an understanding as to the patterns that have played out in the individual's life that might suggest autism or ADHD. And even without family input, the nature of the assessments that we do, they're really quite extensive. So the kind of medical and developmental history taking, seeking that information from other sources like medical records, prior assessments, therapy records, it really does help us to get all of the information that we need. So whilst childhood information can be helpful, all of these other areas of information that we can draw from mean that it's still possible to make an accurate diagnosis without the child informant or the information from childhood present.
Brilliant, thank you, Sarah. So lots of sources of information you can draw on. I think I'll ask you this next one as well, because Jeanette from Frinton-on-Sea would like to know, how does the assessment manage to detect autism and ADHD in individuals who are masking well, especially a girl or woman who has learned to mask throughout their lives?
Yeah, that's a very common kind of presentation that we tend to assess here at Autism Anglia. As many individuals learn to suppress or mimic behaviours to fit in socially in a neurotypical world, which again may make diagnosis harder, but still absolutely possible through a really thorough assessment process. I think the key is just accounting for an individual's coping strategies that they may have developed in order to fit into that very neurotypical world, the kind of subtle signs and their history, rather than the obvious symptoms or the kind of stereotypical symptoms that you might see in the DSM-5 criteria. So combining those clinical tools that we use to really explore perhaps difficulties that may be hidden behind the masking, but also combining that with clinical judgment to look for things that might often be overlooked as indicators, such as social anxiety in an individual, difficulties forming deep relationships, or perhaps there being on the surface level indication that an individual is engaging with others around them, but actually in terms of those real kind of meaningful relationships, perhaps that's there's some differences there. Struggles with focus and emotion regulation, despite maybe appearing organised on the surface. We might see that in our ADHD clients where there's masking perhaps going on, and also I think it's important for us as clinicians to think about those common presentations. I think in the question it was acknowledged that it's often women or girls who have quite commonly learn to mask. So keeping in mind those gender differences, and recognizing what traits may look like when they've been internalized and hence overlooked. So, you know, things like social exhaustion, anxiety, or perfectionism, rather than the more overt behaviors.
That's really helpful. Thank you, Sarah. I'm going to skip a few questions ahead just so we can start talking about the diagnosis process for children. So I'd like to ask Jo this question if possible. So Annalisa from Colchester has asked, my GP refused to refer my child for ADHD and autism assessment. They said it's the school's responsibility. She wants to know, is it the school's responsibility? And I'm concerned as she is at a new school and they don't know her so well. What would you advise?
Well, luckily this morning I had a meeting with someone from SNE who actually covers this area. This is only for Colchester though, or Colchester and Tendring. Actually, your GP can still refer. It's not just the school. There is, if you go onto the SNE website, there is a link there that will take you to the referral pages, and there you'll have the referral forms. And now it's not just schools and GPs, it can be the lead professional. So it could be a family support worker who refers you. So that's totally wrong. There was a big mix up because schools were told they were going to do it. And GPs were very happy to hand over. Schools didn't particularly realise they were taking over. So there was quite a bit of communication difficulties. But that seems to be now sorted, and you can now be referred by your GP or whoever the lead professional is who knows your child best.
Lovely, that's really good to know. Thank you, Jo. And I'll ask you this one as well. Bilkis from Huntingdon would like to know, my 7-year-old boy has autism and shows signs of ADHD. How can I get someone in his school to listen and get help for my boy so he reaches his full potential?
Right, well, it may be that actually your son isn't presenting the same in school as he is at home. So that might be a difficulty for teachers and school staff to actually see that there's any sort of difference. If I was you, I would go to the local offer. Every area has to have a local offer. And on there you will find the contact details for SENDIAS. And every local authority has one of those as well, and they're impartial and they give you the advice on how to get support within the school. You could also keep a diary yourself of what happens at home, and then when you do compare the two, that with maybe a diary from school, you'll see where those differences are, but it might pick out where you're getting more difficulties at home after school.
Brilliant, thank you. We've got Simone from Rowhedge would like to know. So she says, my daughter has just been recognised as having potential for ADHD and the forms have been completed by myself and the school, but I have no idea what happens now. What is the process? I feel like this is a Jenny and Vicky question. Do you want to decide who speaks first? Jenny, thank you.
I'll pick it up first. I mean, I can certainly talk about our own service. So we have a screening process. Obviously, I don't know if this person is using our service, but I would imagine what they're describing is that some kind of pre-assessment screenings have been completed. So in our service, we would analyse them. We would then gather more information by talking to the parents. We would ask them to fill in a very comprehensive form, which would then get triaged, and part of that is also looking at a risk summary, so making sure it is the right time for that child and that it is the right pathway. So we gather a lot of information together. We include information from the school and from the GP as well. So all of these sort of gathering information stages probably still going on. Then the next process would be actually to agree if you're going to come in for an assessment or not. In our case, we do have, obviously, like I say, we have a lot of conversations first, and then we decide on allocating an appointment. We use gold standard tools in our service, which means that they're very well tried and tested and accepted by other authorities, as I said earlier. So we would be using the Young Person DIVA 5. In our case, we sort of adhere to the NHS advice, which is that a child should be over 7 to be assessed for ADHD. And then they would come in for the assessment, which would be the child themselves presenting here in person. with their informant, which is usually a person like their parent or carer or someone who can talk to us about their childhood. And then they would have a 2 or 3 hour, it's basically an interview. So the Diva is an interview, and we gather a lot of information and we make sure it's very thorough. Then after that, we would normally provide an outcome within 24 hours, unless we need to gather more information or if the clinicians aren't available for any particular reason. And then following that, you would get a very full report. Our reports are usually between 40 and 60 pages long, including personalised recommendations. And you have a feedback call with the clinician to discuss that report and ask any questions that you might have. And then a couple of months later, you're invited in for a follow-up call, which is usually with myself or our client coordinator, but we can take any additional questions for the clinicians too at that point, but really just to make sure everything is going okay. How did you find the recommendations, and how did you find the diagnosis as made an improvement or non-diagnosis, because we provide the same service whether you actually get a diagnosis or not. So what I've described is how you would get processed through a gold standard service, and there is quite a lot of stages to it. But the reason that's important is that people should be building up the most information possible and meeting you personally to make sure the diagnosis is accurate. I'll pass over to Vicky in case she's got any sort of personal experience that can help with other settings.
So there's another couple of routes that as this person has filled in the forms, I would say that with the NHS, the waiting list, depending on your postcode, can be anything between 3 to 5 years. So it is quite a long wait at the moment to kind of go down the ADHD, the route. So you can obviously ring the NHS and find out where you are within that queue and where you are within the waiting list. And, you know, it should be a similar process in the sense that you would meet with a paediatrician or a clinical psychologist or a psychiatrist. So they're usually the 3 professionals that you would kind of meet within the NHS. Sometimes you have got other specialisms like specialist nurses who can also kind of be involved in that ADHD assessment. And you will also receive a report and a feedback. I'm sure, like you'll receive information from the professional in the report. So, you know, the NHS route is a little bit longer than kind of, you know, the going down the gold standard route that Jenny's just explained as well. So they're probably the 2 main differences.
Lovely, thanks for outlining those 2 routes. I've just got an eye on the time, so I'm going to ask, I think the next one I'll ask is, I'll speak to Jo. Sarah from Colchester has said, I've recently been diagnosed as an adult and I struggle to make and maintain friendships. How can I prevent loneliness and isolation?
Well, I personally would suggest that, you know, you look at what your interests are and then maybe see if there's any local groups that do a similar interest. They can then hopefully get support for you and offer you support. We also have our Asperger group, which runs on the first Wednesday of the month. Jenny, I'm just waiting for the thumbs up. And that's held at our Jigsaw Opportunity Centre at Gosbecks Road. So you can go along there. Everyone there is on the spectrum. You know, they've all come along, and at some point, I mean, I started that service up many years ago before Jenny came into Autism Anglia, and I'm just so glad that it's still going. It must be going for about 10 years now, and everyone who attends is absolutely lovely, and you will soon make friends there.
Oh, that sounds lovely. I think I'll ask you this one as well. Gina from Colchester wants to know, how young can a child diagnosed with ASD attend a specialist school, and how do I go about choosing a school for my child?
Okay, well, special schools, if they're locally maintained, so if they're local authority, they generally have similar age ranges to other mainstream schools. I know one young lad who is looking at a special school at the moment, and he's 4. So I would see if you could, well, first of all, you'd need an EHCP. to get into a special needs school. Then you need to have a look at which schools are in your area. So what area again was that, Catherine? Was that Colchester? Yeah. So that would be, you'd probably be looking at Kingswood Hoe or Lexden Springs. So Lexden Springs is for more complex children. Kingswood Hoe is for more able children. There is we did have a list on how to choose a school, but I would take your EHCP and your child, if possible, if the school will allow you, and go and ask them, take the EHCP, talk to them about it, talk to them about your child, ask if they can meet need, and then on your next time you have your review, that's the school you put down on your EHCP.
Brilliant. Thank you, Jo. I think we can probably squeeze in a couple more questions. We've got one from Danielle from Harwich. How do we deal with masking in school? I'll ask Sarah that one, please.
Yeah, I think Jo went into some detail about that in terms of behaviours, often looking quite different at school and at home. And I think it's key to highlight that, just because a student appears to be coping well at school, it doesn't mean that they aren't struggling. So I think it's about schools paying attention to the subtle signs of stress, exhaustion, social difficulties, and also having that kind of regular contact with parents, because what often happens is that parents report different behaviours at home, such as meltdowns or emotional exhaustion, withdrawal, and all of these are signs that can indicate that a child is masking at school. So that communication between home and school is key to understanding the full picture. I think it's important for schools to understand that masking can be exhausting and lead to burnout. So that provision of emotional support for the student, validating their struggles, and kind of being able to adjust expectations on students when needed, using flexible learning methods, keeping instructions clear, and making sure that routines are predictable to reduce those levels of anxiety. Things like offering low stimulation areas, flexible break times, allowing those spaces for students to decompress and recharge, and hence hopefully then reducing the need for them to mask. And the final thing that I'm thinking is just about having those really key relationships with teachers, those trusting relationships, perhaps having a key person for an individual to feel safe enough to express their struggles, instead of kind of feeling like they have to constantly mask them. Those are I think the key things that come to mind right now.
Great advice. Yeah, thank you, Sarah. I'm going to try and squeeze in one more question before we have to wrap up. Somehow time has flown. So Sam from Nayland has asked, how do I ask for reasonable adjustments at work, and what are some examples of reasonable adjustments? I think I'll ask Jenny this question, please.
Okay, yeah, it's a really good question. Really important to have the confidence to ask for reasonable adjustments if you so wish. There's quite a lot you could talk about what stage to ask for them if you're actually applying for jobs, and how you can actually, you don't have to declare on that initial reach out or that initial application, but you might want to declare before an interview, because you can have different adjustments made at interviews, for example, to know the questions beforehand, etc. But basically you have the right to ask for reasonable adjustments in work, and in school too, but talking about work, under the Equality Act 2010. There are several different adjustments you could ask for. You might want to approach your manager and have a talk with them, and then decide with them if they can help you by talking to other people, your colleagues, and talking about any communication differences that you might have. There is what we provide in our service is that when you register with us, we can give you a reasonable adjustments letter, which can be quite generic at the start, but just say this person is on our waiting list, they're coming into us for assessment. But in the meantime, these are some adjustments that you might want to make while they're waiting, because by the time you've got to that stage, we already have indications that it could be affecting you because of the pre-diagnostic screening that you've done with us. Then you can give that generic letter, and then by the time you've had your assessment, then you will actually get your full diagnostic report, and we can give you an abridged report as well, which is slightly depersonalized, but still has those recommendations that would be so helpful for an employer to know about how to make the adjustments that will help you, and that's all personalized for you. So I'm going to pick out a couple because I know that we're running out of time. Minimizing environmental distractions might be really helpful for you if you've got sensory sensitivities or flickering lights or such like, or a noisy environment. You might want to have somewhere a bit more secluded to work. Taking breaks, as we mentioned, like with the masking at school, it could be that's really important for you. And giving individuals a bit more time to process information, so they can think and plan their responses. And even just being kind to your colleagues. Don't assume that because you react in a certain way to things, or that you think something is great, like going for a big social event after work or something. No one should feel any pressure to sort of conform to those social niceties. So I think it's important to give individuals what they need in a personal way.
Definitely. Thanks, Jenny. Thanks for those examples. And I think I'd imagine having that letter as well will give people perhaps more confidence to feel like they can ask for those adjustments as well, which sometimes can be half of the battle, can't it? Right, I'm just going to, hopefully you can see my slides now. I'm just going to wrap up. Somehow it's already 2 o'clock. I don't know how that happened, but thank you so much to the team. And thank you so much, everyone, for all of your questions.